been 5 months since liberals in Congress rammed through Obamacare against the will of the American people. But even in that short time, something remarkable has happened. The promise that Speaker of the House Nancy Pelosi made before the bill was passed has come true. You may recall this famous pledge.
But we have to pass the bill so that you can find out what is in it.
Well, now that the dust has settled, the results have started to roll in, and they're not very pretty. Here are just a few of the things we hate about Obamacare. Number 1, this is big government on steroids. Obamacare creates 68 grant programs, 47 bureaucratic entities, 29 demonstration or pilot programs, 6 regulatory systems, 6 compliance standards, and 2 entitlements. And that's not even counting the cabinet department dedicated to Speaker Pelosi's plastic surgery. Number 2, Obamacare creates a dictatorship of bureaucrats. Under the law's language, Secretary of Health and Human Services Kathleen Sabalas can make policy judgments that can't be challenged either administratively or through the courts. That's an affront to the rule of law and to the separation of powers. Or, as they call it in Chicago, a good start. Number 3, we're being lied to about the plan's so-called savings. President Obama and company have touted health care reform as a way to bring down deficits over the long run, but they've only been able to make the case by tricks like double counting Medicare savings and delaying the most expensive parts of the bill. The government's numbers make Bernie Madoff look like H&R Block's Employee of the Month. Number 4, you might lose your insurance. Remember the president's frequent claims that if you like your health insurance, you won't have to change it? It turns out that's not true in the long run. The administration's own number shows that as many as 117 million people might have to change their insurance plans by 2013, which is particularly ironic when you consider that the president might have just lost his own employer-provided coverage that year. Number 5, it will drive up costs. The nonpartisan Congressional Budget Office has predicted that premiums for some families could increase by as much as $2,100. That may be about what Michelle Obama paid per night for her Spanish hotel room. But for the rest of us, it's real money. Number 6, it will raise taxes. One of the most curious of these hikes will be the 40% excise tax on so-called Cadillac health plans, the most comprehensive health care packages available. Apparently, the same liberals who want to make sure that everyone gets world-class health care think that the best way to get there is by taxing world-class health care. Number 7. Finally, there's perhaps the worst aspect of Obamacare. It looks like this. That's right. This bureaucratic labyrinth is what President Obama's grand vision will look like when it hits the ground. It's a system only government could love. One where it's easier to become a brain surgeon than to get an appointment with one. For the moment, these are all coming attractions. We still have time to repeal Obamacare before it's too late, and we better. Unless you feel comfortable seeing this on your way into the emergency room. That's this week's Freedom Minute.